Well, we're starting off with some health news for you. It is not a well-known condition, but 50 million Americans are suffering from peripheral neuropathy right now. Many more cases are undiagnosed. Some local doctors join me now to explain how technology, not pills, is revolutionizing this treatment for this debilitating condition. Doctors Matt DiDuro and Dr. Matt Dunn of ATL Pain Institute are here with patient Lois Kaler. Welcome back, doctors.
Thank you. Thanks so much.
Welcome to the show, Lois. Appreciate you being here. And we're going to hear your story in just a second. But let's start with you, doctor. Tell us what in the world is peripheral neuropathy.
Sure. Peripheral neuropathy is when you start to get damage to the small nerves in the hands, the feet, and the toes. A lot of patients will experience burning, tingling, numbness, even restless leg type symptoms. And in the nerves in the hands and feet, you should have about 150,000 nerve endings. They look like the end of a dandelion. And when you start to get that damage in there, you start to get a lot of these symptoms.
And what actually causes neuropathy?
Some of the top three things are diabetes, also patients who use statin drugs, low back issues like sciatica that Miss Lois had, and then also patients with chemotherapy. So we're working with a lot of different groups of patients out there now.
And what's being done to treat it? Traditionally, what is being done, and how are you guys different?
Well, the traditional treatment has been mostly medications. There's really no surgeries that affect peripheral neuropathy. But one of the key things is that not every patient is treatable, and we've developed a protocol to find what patients are treatable. We need to find out how much damage they have in the nerves, as well as, what specific nerve types are damaged. Once we get to the bottom of that, we can actually start to put together a treatment protocol customized for that patient.
Okay.
One of the exciting things I can share with you is that the newest technology we're using is a FDA cleared, it's very safe, it's a low-level light therapy. And what that does is it actually increases the circulation around those nerves, and it starts to bring those nerves back online.
Wonderful. I'm looking at a picture of that right now. And how are patients responding to that?
They're responding great. Patients have a 90% satisfaction rate.
That's fantastic.
And those are the people who qualify. So that pre-screening initial exam really helps us find out which patients are going to do well and which will not.
Right.
So we brought Miss Lois on today because a pretty amazing story.
Good.
She came to us about 7 weeks ago, and she had slipped in her kitchen and fallen, and within a couple days had just kind of couldn't walk, couldn't sit, couldn't stand, and had MRIs done, and had severe neuropathy and sciatica down her right leg.
Oh no,
Muscles.
This is something, excuse me, that you hadn't been feeling these symptoms prior to this fall then?
No.
Wow, so it brought on all of these things.
Right, and she had severe atrophy as well in the legs. So your daughter is the one who kind of told you to come in, right?
Yes.
And
tell us what happened. You went to see the doctors and said, this is the way I'm feeling?
They took me in a wheelchair. I could not walk. I could not stand. I could not sit. All I could do was lay flat on my back. I had several treatments, I believe about 6 before I was actually back on my feet again. But I walked into the office, I think on the 6th or the 7th treatment.
Wonderful.
yeah, it was pretty exciting.
And now I'm doing wonderfully well.
Oh, and I know for you, having to be laid up like that, and I mean, no quality of life when you're like that in an excruciating pain, to now, just a few short weeks later, it's like a new lease on life, I'm sure.
Oh, it's wonderful. It's wonderful.
Now, is this typical, doctors?
She had really a quick result. Some patients who've had the condition longer, it takes a little longer.
Okay.
But these pads help increase the blood supply, so you get oxygen-dense blood down into that area, allow that tissue to come back and heal. We used it on her low back, we used it on her leg, the whole length of that sciatic nerve, and she did great. I mean, she had lost 12 pounds because she couldn't even eat. She had no appetite. And, we give her a lot of credit because what did I tell you? We got to get you out of that bed. We got to get you moving.
Good.
Right?
Yes.
And I mean, she's done wonderful. It's such a good story. We want to come out and share it.
Absolutely, because I'm sure, as you said, there are many cases that go undiagnosed. So just get in there, call the number. There's the website. If you even have these symptoms and you think that they can help, get to the screening. That's the most important thing, right?
Let us find out. We've got girls standing by the phones right now. We have a special offer. Should we go over that now?
Yeah, tell me.
We're going to take the first 45 qualified callers. We're going to give them their initial exam, they'll get a cardiac screening, and they'll also have the first day of treatment. And all that for $47.
Oh
so
my
it's
gosh.
typically around $250 for that whole.
That's fantastic.
Yeah.
And once again, we have a little extra time. My producer was saying, go ahead and talk about the symptoms, because if that many people are suffering from this condition, you know, and they're thinking, wait a minute, this is striking a chord, this is me. Tell us again, you know, what we should be aware of.
Well, a lot of times, you know, the standard of care is to treat these with strong medications. So they use anti-seizure like
Oh my gosh.
gabapentin, amitriptyline, Neurontin, Lyrica. These are the big, strong meds that they're on. And we want to do is not just treat the symptoms, we want to get to the cause
Right.
and really find out what's the issue. If it's a spinal issue, that's one thing, we can work with that. But if it's the, you know, the numbness and tingling brought on by the diabetes or the peripheral neuropathy or restless leg syndrome, we can work with as well.
And how was it having that? I mean, for anybody out there who's considering it, how did it feel actually getting the treatment done with the laser light?
Oh, it's wonderful. Once you have that on there and it's taken off, it seems to feel better every time.
Every single time.
Every time.
That's fantastic.
It's totally painless, too.
Yeah,
I mean, you're
yeah,
sitting
Yeah,
and
that's
a
what
lot
I
of
wanted her to
patients
tell
fall
me.
asleep.
Yeah, I mean, you know, is it a little warm or is it fine? It's no big deal. You can read a book while you're getting it done. It wasn't anything that was painful
No.
or or stressful about it.
No pain.
And then you end up after just a couple of treatments feeling 100% better.
Oh,
So
yeah.
That's
Much better.
fantastic. Thank you for being here. You look phenomenal.
Oh, you're welcome.
So good.
Thank you.
And hopefully more people will call and get the same results. And thank you always for being here. We appreciate your time. And thanks for making us aware, for those that weren't, of this condition and how you can help. We appreciate it. And again, if you would like to take advantage of their very generous offer, to find out more information, just call 855-ATL-FREE. That's 855-285-3733, or log on to freemypainnow.com. I like that website name, freemypainnow.com. And this segment was paid for by Neuropathy Treatment Centers of America. Thank you again, doctors.
Okay.